What if I told you that the pill sitting right next to your bed, the one you reach for almost automatically every morning, could be quietly working against your body instead of helping it? I'm talking about that little tablet you trust for relief, the one you believe is keeping you moving, keeping you functional, keeping your pain under control. Now I know that sounds dramatic, maybe even a little hard to believe. But stay with me, because what I'm about to share might completely change the way you think about pain, inflammation, and what real healing actually looks like. Before we go any further, welcome to Dr. Martin Health Tips. I'm Dr. Art, also known as Dr. Clarence Martin, and on this channel, we talk about simple, science-backed ways to help you move better, feel stronger, and take control of your health without depending on a cabinet full of pills. Now let's get real for a moment. Ibuprofen works. I'm not here to pretend it doesn't. You take it, the pain eases, and for a few hours, you feel like yourself again. That's the cycle millions of people live in every single day. But here's what most people don't realize. That relief comes at a cost. Because ibuprofen doesn't just block pain, it blocks processes in your body that are actually there to protect you. The same mechanism that reduces inflammation can also weaken your stomach lining, stress your kidneys, and interfere with your body's natural healing responses when used long-term. I've seen it firsthand over years of working with patients. People come in thinking they're managing their joint pain, but what they're really doing is masking it while the root problem continues to build underneath. Knee pain that never fully goes away. Stiffness that slowly gets worse. Joints that feel older than they should. And often, digestive issues that seem unrelated until we connect the dots. So the question becomes, is there another way? Something that doesn't just silence the pain temporarily, but actually supports your body while reducing inflammation? There is. And surprisingly, it's not hidden in a pharmacy. It's been sitting in kitchens around the world for centuries. I'm talking about high-quality extra virgin olive oil. Now, before you scroll away thinking this is too simple to be true, hear me out, because this is where things get really interesting. There's a natural compound in extra virgin olive oil called oleocanthal, and what makes this compound so powerful is that it works in a very similar way to ibuprofen. It targets the same inflammatory pathways in your body, helping to reduce pain and swelling at the source. But here's the difference. Instead of damaging your system over time, it actually supports it. It helps protect your heart. It contributes to better gut health. It works with your body instead of fighting against it. And this isn't just theory. Research has shown that regular consumption of olive oil rich in oleocanthal can reduce markers of inflammation in the body, the same markers that are elevated in people with chronic joint pain. So instead of hitting inflammation like a hammer and then wearing off, this works more like a steady, supportive force that builds over time. Think of it this way. Ibuprofen is like flipping a switch. Fast, powerful, but temporary. Olive oil is like adjusting the entire system gradually, creating an environment where inflammation has less room to exist in the first place. Now let's talk about what this means for your joints. Because knee pain, shoulder stiffness, aching hands, these aren't just isolated problems. They're often part of a bigger picture of inflammation throughout the body. When that inflammation stays high, your joints become more sensitive, more irritated, and more prone to pain. When you consistently bring that inflammation down, something interesting happens. Movement becomes easier. Stiffness starts to loosen. Pain doesn't disappear overnight, but it becomes manageable in a completely different way. And I've seen this shift happen again and again. People who relied on daily painkillers start needing them less. People who avoided stairs begin climbing them again. Not because of a miracle, but because their bodies were finally given the right support. But here's something important. Not all olive oil will give you these benefits. This part matters more than most people think. The oil has to be truly extra virgin, cold-pressed, fresh, and rich in those natural compounds. You should actually feel a slight peppery sensation in the back of your throat when you take it. That's a sign you're getting the good stuff. So how do you use it? It's simple. Start your day with about a tablespoon on an empty stomach if you can. Then use it throughout the day in your meals. Drizzle it over vegetables, mix it into salads, add it after cooking rather than frying it at high heat. The goal is consistency, not perfection. And there's another layer most people overlook. You can also apply it directly to your joints. Gently warming a small amount and massaging it into your knees, shoulders, or hands can provide localized relief while also improving circulation in the area. It's not just about what you take in, it's also about how you support the body from the outside. Now let's be clear. This isn't about throwing away every medication overnight. If you've been using ibuprofen regularly, you need to be smart about any changes. But what this does is give you an alternative, a way to start reducing your reliance on quick fixes and move towards something more sustainable. Because the goal isn't just to feel better for a few hours. The goal is to feel better consistently, to wake up with less stiffness, to move with more confidence, to break out of that cycle where pain controls your daily decisions. And when you combine this with simple habits like staying active, getting enough sleep, and eating anti-inflammatory foods, the effect becomes even stronger. Your body starts working with you instead of against you. So here's what I want you to do. Try this for the next 30 days. Be consistent. Pay attention to how your body feels. Notice the small changes, because those small changes are what lead to real, lasting improvement. And if you're someone who's been dealing with joint pain for years, I want you to understand something. This doesn't have to be your normal. Your body still has the ability to adapt, to recover, to improve. You just have to give it the right tools. If this opened your eyes even a little bit, make sure you subscribe to Dr. Martin Health Tips, because every week we break down simple, practical ways to help you take control of your health naturally. Take care of your body, keep moving, and I'll see you in the next video.